of allergies and focus on immunotherapy. Allergic diseases can manifest in many forms, and the very common ones are as the risk factors for allergies are dependent on a combination of genetic factors. So these are the hereditary factors and some DNA modifications, as well as the trigger factors, the environmental factors, or what we call the allergens, from some common sources, such as dust mites, cockroaches, animal dander, food, pollen, and insect stings. The allergy management should start with the identification of what is the trigger factor. We have heard previously that we can get this done by various ways, including the skin prick test, blood test, and also a patch test. Once the trigger factor is identified, then patient needs to be educated to understand what is the trigger factor, and therefore they can then learn how to avoid the allergen and minimize their exposure to the allergen if possible. The patient should also communicate this information to others, especially those who they live with, to further prevent any exposure to the allergen and possibly limit allergic reactions from related allergens. Finally is clinical management. So Prof. Salina has talked to us about symptomatic relief using antihistamines, using steroids. Other than that, there are also biologicals and the topic of my talk today, which is immunotherapy. So I'll talk a little bit about allergen avoidance first. This is the simplest and most effective way to manage the allergies. And it's best in the management for easily avoidable allergens, such as pet dander and food allergens. In case of dust mite management, it's a little bit more tricky to completely avoid it, but we can minimize using items such as impermeable bed covers, a choice of upholstery that can be easily wiped down, reducing carpeting, for mold management to ensure that the indoor environment is not humid to reduce the growth of the mold within the house, and to minimize airborne allergen exposure, for example, during cleaning, to use air filters, and to use a face mask. In terms of pharmacological treatment, the options are available and suitable for mild to moderate allergy intensities. So these are, as previously described in detail, antihistamines and corticosteroids. And these pharmacological treatments have the effect of rapid improvement of allergic symptoms. So it reduces the excess mucus, itchiness, and wheezing, but it's not long lasting. So it needs to be taken at regular intervals. When it comes to immunotherapy, this is a vaccination program that increases the immunity to allergens that trigger the allergic reactions. And the aim of immunotherapy is to generate tolerance to the allergen by modifying the immune response. How does it work? So the body treats the shot, the allergen shot or immunotherapy, like a vaccine, and it starts to produce antibodies against that particular allergen. So you start off with injecting or introducing small doses of allergen and build it up over time. So the body starts to also produce more and more antibodies over time. So in terms of an injection-based immunotherapy, it can be given once or twice a week to start off with. And when a constant dose is achieved, to give then monthly for up to a 3 to 5 year therapy time. The treatment lasts for 5 to 10 years after the allergy shots are stopped. So you have a long-term symptomatic relief. What are the pros and cons of this type of immunotherapy? So let's talk about the pros first. There's definitely a reduction on the dependence of medication. So you can take less allergy medication. Long term, it will decrease your cost, and it treats the underlying cause of allergy and not only the symptoms. Taking a pharmacotherapy merely deals with the symptoms alone. For immunotherapy, it is possible to treat multiple allergies at the same time, and it provides a long-term allergy relief. So like any other medication, immunotherapy also comes with some cons, some limitations. There's higher upfront costs. It can result in redness, swelling, tenderness at the injection site. It needs a time commitment. So you need to go to the doctor's office and get your injections. So there's a time commitment required. At the beginning of the immunotherapy, in some individuals, the allergy symptoms can worsen initially, and there is a low risk of anaphylaxis, which are often treated very well by the 30-minute observation in the physician's office. And as Dr. Kent has already alluded, it can be treated with the epinephrine autoinjection and with physician's care. The other benefits of immunotherapy are to prevent the development of new allergies, and in children, prevent the progression of allergic rhinitis to asthma. So prevent this severe conditions to occur. Immunotherapy is recommended for individuals with allergic asthma, allergic rhinitis, allergic conjunctivitis, hat allergy, and stinging insect allergy. And it can only be provided and administered upon the suitability assessment by an allergy specialist. So there are two main modes of immunotherapy. They are the so-called allergy shots or subcutaneous immunotherapy and the sublingual immunotherapy or allergy drops, otherwise known as allergy tablets. So let's have a look at that. The subcutaneous immunotherapy involves an injection to the upper arm. There is an updosing, so increasing of dose of the immunotherapy product weekly, and after a certain period, a maintenance monthly. And it's a 3 to 5 year protocol, so you need to take the shots for between 3 to 5 years. And it's available for allergens such as the house dust mite, birch pollen, Timothy grass, and ryegrass. In terms of the sublingual immunotherapy, there are no injections. So the allergen extract is placed under the tongue, either in the form of a drop or in the form of tablets. And it's available for a mixture of grass pollen or Timothy grass, short ragweed, house dust mites. The benefit of sublingual immunotherapy is very convenient. The patient can do it in the comfort of his own home. And it has also shown reduced risk of anaphylaxis and systemic effects compared to the use of subcutaneous immunotherapy. So as I've mentioned before, there are some limitations of immunotherapy. So it does not work for every type of allergy. Currently, the products available are suitable for certain types of allergy, but these are the more common ones, so such as fat dander, pollen and dust mites, and general insect allergies. Immunotherapy to some of the food allergens are available, but they need very strict patient evaluation and monitoring by the physician. So as I've mentioned before, you could have that can modify the allergic immune response. It has long-term benefits of reducing the patient's allergic symptoms and improving the quality of life. Suitability to receive immunotherapy must be carefully assessed by an allergy specialist. So with this, I thank you for your attention. So next up, I would like to invite Dr. Nazreen Arifin to give a talk on eczema care. Dr. Nazreen graduated from the Royal College of Surgeons in Ireland in 1997 and later obtained a master's in clinical dermatology from St. John's Institute of Dermatology, St. Thomas Hospital in London in 2007. Dr. Nazreen is a consultant dermatologist that practices at Pantai Hospital, Kuala Lumpur, and has a private practice at Nazreen Skin Clinic in Mid Valley, Kuala Lumpur. Dr. Nazreen?
Hello, everyone. Thank you very much, Dr. Kavita, for the kind introduction. Okay, today I would like to talk about eczema care. Let me share the screen.